Hello everybody. Today's video is about seasonal allergies, or as I like to say, 'tis the season for sneezing. So right now in North Carolina, we're experiencing some pretty high pollen levels, and a lot of us have itchy eyes and clear, watery, runny noses, even children. So I get a lot of questions this time of year about allergies and allergy management. One of the first ones is, does my infant baby have seasonal allergies because they have a runny nose? And the answer is almost certainly no. The allergists say that the infant needs to be exposed to the same antigen or pollens for at least 2 seasons before developing true IgE mediated mast cell histamine releasing kind of allergies. So perhaps if you were out on an extremely high pollen count day and there was just so much dust and particulate matter in the air, the baby could be irritated a little bit by that. But certainly in an infant, if there's a lot of runny nose, cough, and sneezing, and certainly if there's fever, then that is not plain allergies. So if you asked me if your 3-year-old who has chronic clear runny nose and sneezing and watery itchy eyes has allergies, well, that's much better of a possibility. I would say yes. The next question I most often get is, well, then does my 3-year-old need to go to see the allergy specialist and get testing? Not necessarily. We would rather give your child a try on a non-sedating oral, that means by mouth, antihistamine like Zyrtec or Allegra or Claritin. And generally that's the strength in order. Those are the strongest. So Zyrtec will be the strongest, Allegra the medium, and Claritin the weakest. Now the absolutely strongest is sedating. So those 3 I mentioned, Zyrtec, Allegra, Claritin, those are the brand names. Generic is fine as always. It's all I ever use. But they're considered non-sedating. They're supposed to last for 24 hours. You could dose your child in the morning with those. But the most effective antihistamine is Benadryl or diphenhydramine, which is sedating. And there are some other sedating antihistamines as well, like brompheniramine, that's in Dimetapp, and things like that, that are more sedating. And they generally are stronger and more effective the more sedating they are. So a very frequent, commonly used trick we do is we'll do the non-sedating antihistamine in the morning so the child can get through school without being sleepy but still have some allergy relief of symptoms. But then at bedtime, if they're still feeling very itchy, watery, sneezy, or uncomfortable, you could always do a dose of Benadryl. So if your child was having trouble sleeping because of the allergies, the Benadryl could help since it's sedating. But do remember, 9 out of 10 children and adults get sleepy with Benadryl, but there's always that chance that your child is the 1 out of 10 that it can make a little more hyper instead of sleepy, and that would be a shame because it's kind of nice to have that side effect of improved sleep at night and help from the allergy symptoms. The other things that you can do are just simply mechanical. As soon as your child comes in for the final time of playing that day during allergy season, just go ahead and let him have a shower and rinse all that pollen off. Even if you're just going to even rinse their hair out, if it's not shampoo night, just rinse out all the pollen. That would be a good idea. Also, it's tempting when the nights are cool and the days are hot to save some air conditioning money by opening the windows and letting the cool night air come in through the screen. However, bummer, if you have allergies or your child has allergies, that's not actually a good idea because those pesky little pollen molecules can come in through the windows too, and that'll just make you all the more symptomatic. Now, if you are not getting relief from the morning non-sedating and the, if needed, bedtime Benadryl, then the next thing we would suggest before allergy testing is to do a nasal steroid spray. There are a bunch of different brand names like Nasonex, which is FDA approved down to 2 years, and then many other ones, Flonase, Nasacort, Rhinocort, and multiple other ones as well. In general, the recommendation is under age 12, 1 squirt each nostril once a day. After age 12, 2 squirts each nostril once a day. And even then, once good symptom control is achieved, you can decrease down to 1 spray each nostril once a day and save a little money. I have often found personally and with patients that the use of the nasal steroid spray helps a lot with ocular symptoms or your eyeballs being so itchy because it's going to reduce all the inflammation in this whole area, and it can help a lot with itchy eyes during allergy season. So I really recommend the nasal steroid sprays. The other thing that's cool about about them is, you know, there's a big relationship between children who are prone to allergies during the season and a sinus infection. So if you imagine you're keeping all this general department inflamed from all the allergies, it's going to be easy to develop a bacterial sinusitis. And so if we can control the allergy symptoms better, such as with the use of the nasal steroid spray, maybe it will cut down on the chances of developing a sinusitis. And it's often even hard for us during the season to know the difference. One of our definitions of a bacterial sinusitis is if the nasal drainage has lasted longer than 2 weeks. Well, with allergy season, of course, it's going to last the entire season, so it is hard to tell. Certainly, if there's fever, it's more than just allergies. Now, some parents will ask me too, if my child has a cough, could that still be the allergies? Yes, because imagine your sinuses in your nose. You're making all this mucus, and some of it's going to drip down the back, and that can certainly trigger a cough. So some of the same supportive care measures we've recommended for colds and coughs, you can also do for allergies. You might have your child sleep with its head elevated a bit. You could run a cool mist humidifier, encourage them to blow out the mucus and not sniff it up and swallow it and make their throat sore. You could gargle warm salt water. You could drink warm tea or warm apple cider with honey mixed in. All these tips work for the symptoms of allergies as well as the symptoms of a cold. So we'd recommend that. The other thing I was going to remind you of is the reason you don't necessarily need allergy testing is you can think about when your child has symptoms. If it's always in the spring, then it's probably a pollen from a tree or a weed or a grass or something in the environment. If it's year-round, it could be molds, mildews, or dust mites. Or if it's in the fall, beginning around the end of August, it's almost certainly ragweed. And so a lot of people only have allergy symptoms in the spring and fall from pollens, and that's very common. And in those cases, I'm not sure it would be extremely helpful necessarily to have an allergist evaluation. Now, if we can't control your child's symptoms with all these things we've discussed, we're always happy to make a referral to an allergist to have a further evaluation. And then you could talk with them about the specific antigens that might be triggering the symptoms. And we're also much quicker, very quick, to refer to an allergist if we have concerns about a food allergy. That's a different category than what we covered today. So I hope this has been helpful, and you know, as always, this is just general medical advice and does not necessarily apply to your specific child, and you should always direct your questions to your child's own physician.